Good evening to all the members who are joining us for this session on Detox. I am Mashood Bhatt, your host for this session at Detox, where we are trying to showcase and bring together stakeholders who are involved in implementing disruptive solutions to help achieve the goals of universal foundation literacy and numeracy, these goals which are committed under the SDG 4 and also under India's national education policy. The focus of today's talks have been on the education and foundational education of girls. And just early in the morning and the afternoon, we had two phenomenal speakers, two phenomenal women with who have just shown that girls are full of limitless talent and we had Niharika ji from Yuva Jharkhand, who talked about how, in a very interesting way, her institution has weaved football and life skills in the education of the children. And very recently, one of her students, Seema, belonging to a small village in Jharkhand, made it all the way to Harvard on a full scholarship. We also heard from Ms. Chandni Di, who is the founder of Voice of Slum. Her journey started from a slum. She lost her father at a very young age, and now she worked hard, and now she has her own NGO working on education and nutrition of children. With this, we would like to invite our third speaker for today, an equally phenomenal person. He has a very long list of accomplishments, but just to name a few, he is the project director at Ekatrit Educate Girls. Previously, has also been associated with the Planning Commission, with ARC Charity, Ministry of Education, Liberia, Teach for India, and has had a phenomenal academic record as a World Bank scholar and also a student at the Kennedy School of Government. So with this, we would like to invite Mr. Prateek Kanwalji to today's talk. Prateek ji, thank you so much for your very valuable time.
Thanks, Masood, for inviting me. And I just heard the list of the speakers who spoke. I wish I can be half as effective as they have been in doing the work they do. So, phenomenal profiles and phenomenal stories you've been able to capture in the morning session. I hope I live the expectation of this session as well.
Absolutely. So Prateek ji, again, we would like to welcome you. And the third session for today is a very interesting one where we are also trying to understand how foundational learning of girls can be supported during and also after the COVID as well. As all of us are aware, those who are joining us as well on YouTube, Facebook, and other pages, we are aware that COVID-19 has triggered the lockdowns which have been triggered because of COVID have negatively affected more than 250 million children in India alone. And almost 1 out of 4 children do not have access to digital devices. So in your assessment, Prateek ji, how do you think, COVID and the related issues have affected the education of girls specifically?
Let me start off with with an anecdote or a story which can sort of help you put things in perspective, right? A girl in any Hindi heartland state or any backward district of this country, as it is, was at the margins, right? Why I'm saying that is, a girl used to eat in the end, even when the pandemic was not there, right? In this case, we're not sure even whether she's eating or not. So forget about the education aspect of it. Earlier, the case was that, the boys would go to school, and if the girl is lucky, that she would go to school. Now the boys are not even going to school. So we don't even know the plight of the girl in this case, right? So the disproportionate impact of COVID-19 has been on the girl because they were already at the margins, right? They were not that their lives were better off before pandemic, that, it has regressed. It was already at the fringes. It has gone way beyond now. Cases of human trafficking, child marriage, and child labor, especially with respect to girl, has increased a lot in the Hindi heartland states. And not to say that it was not happening, but the rate at which it is happening has increased. Chances were that, okay, there was a mobile phone in the house, even it was not digital or not thing, but there was a mobile phone in the house, and girl would have some chance of getting hold of it after the boys have played with it in the house. Now that mobile phone probably would also have to be sold to make ends meet, right? So there's, we talk about digital divide, there is no divide, right? It's absolutely black and white, right? They do not have access to it. There is no divide. Divide is when at least, okay, some have it, some don't have it. In this case, none of the girls have it, right? Only the upper echelons would probably have access to it. Even middle class, the boys would first get access to it, right? If there was one, right, in the household, right? So I think the impact has been disproportionate. The impact has been far, more than human imagination can go, to a certain extent, that whatever good work had happened in the last 2 decades has all been undone, right? So if there are SDG 2030 targets, I feel we need, at least minimum 30-40 more years to undo the loss of what the pandemic has caused. Because look at it from the aspect of nutrition as well. There was no discrimination in providing midday meal. That was the only non-discrimination aspect of our schooling, right? That if a kid reaches a school, right, be it a boy or a girl, will get food, right? In this case now, nobody is getting to school, so that girls' last hope of getting at least a full meal at home is also gone, right? So it is I feel sad about it, but I feel if we do not get the reality out, we will not even work towards it, right? So this is the reality where we start off it. The impact has been devastating, right? And not only to a certain section, but at scale, right? So it's not just a percentage of population; it is almost 60 to 70% of the rural population which is getting affected by it at this present point, right? So Educate Girls has gone and ensured that ration is delivered to all the households in the village we work with, and we work with fair few amount of villages. We work in almost 30-35 districts, and saturate all, at least the 15 20 district villages, wherein, and the rest of it we are going in the most marginalized villages, where our funders have now given us funds to ensure ration delivery is happening door to door, and we are also linking it that they're getting the ration because of the girl child, because we've identified the household because of the girl child in the household, right? So it's important to stress the fact that the ration is coming because of the girl, right? To ensure that the value of proposition of the girl in the household increases a bit as well, right? It's more of a behavioral nudge, but the plight is unimaginable, to say the least.
Right. So, I mean, as you've very clearly elaborated that the situation has disproportionately affected the position of the girl child, especially the education of the girl child as well. And like you said, that nutrition is the nutrition comes first, and that is actually itself a severe challenge. There's also a lot of evidence which is coming about shifting of children from low fee private schools to government schools. A lot of state governments, for example, are saying that there have been very rising enrollments in government schools post the COVID. And you mentioned midday meal. So one reason which is being said is happening towards the government schools as well. When it comes to enrolling children in the local government school, etc., what is your assessment of how parents are looking at enrolling their children in the schools, especially girls?
So let's look at the last 2 decades. I think the aspirations of the lower middle class and the rural population was more towards that if their kid could, my kid could also, right? Because of the rising middle class, the growing awareness, everybody was starting to see, at least there were green shoots which were starting to emerge, that education is important and let's try to give the best possible education, right? But aspirations are no longer there. It's about survival. First, you have to survive and then aspire, right? When it comes to survival, there are two ways in which that can happen. Either you go to a government school and survive till the time you are able to aspire again, right? Or in worst cases, probably be at home and support the family with basic necessities, right? Midday meal is an important factor, that at least child will get one meal. But look at it from the other side, the demand supply perspective from the government side, right? Allocations have already been made, right, for 2 years, right? For midday meal programs, for teachers, for infrastructure, right? Suddenly the school education system is also going to be burdened by a lot of floating population, right? How do you do provisioning for it? How do you provide teachers, right? Suddenly, if there were 70 students before, 140 turn up, right, and take admissions, government cannot say no. Government doesn't have a policy to say no, right? It has a policy of admitting each and every child, right? But how do you look at learning going forward, right, with those 140 children instead of 70, right, with just a single teacher school in most cases, right? So are we just going to fill the schools, or are we going to teach them? Or are schools going to be just a way of ensuring that nutrition is given till the time we're able to figure out what to do with them, right? So I feel, while in a way, in an ideal world, you would want more and more children to go to government school because they're improving in quality and everybody aspires them to sell. It's not the case. The case in this case is that, the aspirational level of the people have come down, and they feel survival is the only thing which matters at this point, right? So, I would love if most of the students stay when the things are good as well, and the school system ups their game and provides for them, right? But in a crowded space, in a space in which allocations have already been made, we'll have to either provide for more or hope that things starts to improve and the aspirational class at least finds its way back, because the school system cannot support infinite amount of students coming to them suddenly, right? It has to be a planned, phased manner increase. If you see the government planning of budgets, it's increased in a very phased manner. You can't suddenly increase 20% allocation because the students have increased by 20%, right? Schools will have to manage within the constraints, and that's the bigger challenge, right? So suddenly midday meal orders will go from double, and state has to exchequer has to pay for it, right? So either the quality gets diluted, or the exchequer allocates more money. That's something which the exchequer has to decide. I can only say that these are the downstream challenges of what you're saying, and in some cases, the fall could be so sharp that it happens directly for a low fee school to not going to school for a period of time, right? So because you have to sort of, you're disproportionately impacted. Your cases are that, one or two family members have lost their lives, or have been sort of in the recovery phase, and that sort of impacts the family income disproportionately in that case. So that's the long and short of what's going to happen.
You mentioned that our commitments to SDG 2030 might need to be shifted by 20-30 years, right? And one fact which we are aware of is that, as also mentioned in the Educate Girls website as well, that 9 out of 17 Sustainable Development Goals are directly addressed by educating girls. So what we here at Detox are also trying to put our heads around is that there are certain goals we committed to. Of course, we didn't anticipate this kind of a disaster of pandemic happening then. But if we need to, whenever the pandemic normalizes or stabilizes in hopefully the near future, we need a lot of different solutions or disruptive solutions which can disrupt this destiny that it might take 60 or 70 more years to reach those goals. So so would you like to share from your experience, from the experience of Educate Girls, as to how has your team tried to ensure even before pandemic times, of bringing girls back to the fold of education, especially those who are at risk of dropping out? What strategies and innovations can be adopted by all the other organizations as well?
I'll sort of talk about Project Ekatrit here because it directly sort of talks about SDG goals and how we're looking at. So Educate Girls also innovated and started this Project Ekatrit, which I'm leading right now. It's basically to do two things. Bring out research, right, which we already have now, which says that there are certain policy gaps which need to be addressed, right? There are, as my CEO puts it, there are two patches of one of inclusivity, which needs to be put on the policy, and the other is of the outcome focus, right? Whether we are focused on the eventual outcome, right? So we've realized that, while our intent of the policy is great, right? And I'll elaborate with an example later, but we miss the buck on inclusivity. For example, our policy says that every household will be provided water, right? Now, if you read the fine print of that policy, it says, to the grid areas where there's a grid, right? What happens to the off grid? And most of the marginalized population lives off grid, right? For example, let's take the example of tribal people, right? Where do the tribal people stay? In forests, on top of hills, right? In deep secluded areas. That's where the tribals stay, right? So how, if the policy in itself doesn't talk about off-grid areas, right? How do you ensure, water is, reached the most marginalized population, right? And this is the classic problem of, can we provide for everybody, right? The policy in itself talks about everybody, but downstream there are populations, and especially the worst hit population, right, which never get access to it, right? How does this affect the girl, right? A girl has to come down from the hamlet, from the the hill, right, where she, on top of it, where she stays, to the grid areas where the water is available, travel 2 kilometers and take the water back uphill, right? Now, how much time does that take, right? Do you think the boy in the house will do it? No, right? The boy in the house will probably go to school, right? Then, if the goats have to be, fed, or, water has to be given to the animals, again, the same process is followed, right? I've had a chance to interact with girls who say, getting a shower is a luxury, right? Because, the water doesn't remain for people like us, right? They're at the pecking order is at the lowest, right? So, a shower in itself is a necessity, right, in that case. And we're talking about achievement of sustainable development goals. And I'll tell you why this happens. I'll give you one more example, right? We want to aim to solve the problem of menstrual hygiene, right? But when it comes to looking at the school as a system where this could happen, right, we don't even have counselors who can counsel a large chunk of population to adapt safe menstrual hygiene, mechanisms. We don't have products in villages which are biodegradable, which can be given to these girls. So there's a huge chunk of population in this country who doesn't understand the menstrual hygiene, right? Now, how many ministries are involved in this case, right? There is the Health and Sanitation Ministry, Women and Child Development Ministry, Education Ministry, right? Probably, in tribal areas, Tribal Affairs Ministry, in minority-run schools, Minority Affairs Ministry. Who takes the focus on the outcome eventually, right? So that convergence lens or the convergence patch is also missing, right, in the policy, right? That a policy framed by one department doesn't talk to the policy framed by the other department, and the ball is dropped somewhere, right? So if you have to achieve the SDGs and disrupt the SDGs, you need to have a unified policy approach, or the policy needs to address inclusivity, needs to address the convergence issues and outcome focus issues, right? If these three issues are not even salient in the policy, and it's left to interpretation, Chinese whispers happens, and eventually policy doesn't meet the outcome downstream, right? So what we're trying to do at Project Ekatrit is work with the government to actually take this research and show that these are the gaps which just need tweaking, right? Though policy doesn't need to change. Policy is great. We frame great policies, right? Only thing is, if you put a inclusivity lens, convergence lens, and an outcome-focused lens to it, right, you will have policies which will start to perform better, and service delivery will improve on the ground, because service delivery, in a sense, is taken from the policy, right? If policy itself says the grid areas, how will the off-grid areas get water? If the policy itself says, oh, menstrual hygiene, can happen without a counselor or without information campaigns, without product in itself, right? The sanitary products, right? Then
Hmm.
we are not doing justice to these SDG goals, right? To meet in essence these SDG goals, which are quite in your face, given the 2030, this was supposed to be the decade of delivery, right? If you look at SDG goals, if you look at the government of
Right.
India, this is the decade of the delivery. But delivery in itself cannot happen unless the policy in itself talks about the failures of delivery which can happen downstream. Which I'm talking about is leading out a lot of people, right? Not looking at an outcome focus or accountability in the policy itself, and not looking at convergence mechanism, intra-ministerial convergence mechanism. So if you're able to sort for these out, we'll be able to disrupt and move pretty quickly onto the SDG goals.
Absolutely. So like you have put out as to how all the SDG goals are very interconnected as well, and especially when it comes to the development outcomes of the female population, especially how that's also very
Mhm.
connected with how the household, the family, the development outcomes at a more macro level are also intrinsically connected. If we specifically talk about SDG 4, so here at Global Dream also we are looking at two specific targets of SDG 4.1 and 4.6, where we are talking about foundational literacy and numeracy of school children as well, but also of those who are adolescents and who are outside the fold of education. If
Mhm.
we
Mhm.
specifically talk about foundational literacy, how important is that for girls in ensuring the overall development of the household, the community, and the country as a whole?
Let's look at foundational literacy and try to connect that to downstream effects, right, of what girls face, right? Challenges related to child marriage, early childbirth, using having issues with menstrual hygiene, right? And then also issues with no skilling and no jobs downstream, right? So what role foundational learning plays is it at least ensures that the gap doesn't get too widen too quickly, right? If we miss out on foundational learning for girls, and straight away they are, for example, at Educate Girls, we see that girls at the age of 8 or 9 start school, right? And that's not the time to actually do foundational learning, because you can't put a girl in nursery in class 8 at the age of 8 or 9, right? So the child probably comes to first and second, doesn't know how to read, doesn't know how to write, keeps falling back, chances of dropout is very high, right? So foundational learning in itself allows the dropout rate to go down eventually. So and it also allows the parent to see some sort of a growth in the child, which encourages them to invest even further, right? So education is not a self choice, right? It is a choice of the parents, right? So the parent sees that the child is being able to do something which either they could not do or the neighbor could not do, right? They invest more, right? That's the long and short answer of it, because it encourages parents to invest more in their education, and they themselves have less chance of facing issues which are, chances are less. It's not that it will happen. Chances of it happening are less if the foundational learning is taken care of. And in specific, the dropout rates we've seen empirically come down if the girl has gone through the foundational learning phase.
Right. So here we would like to take one question from one of our viewers as well. Anushri is asking what could be the emerging barriers for girls in and after COVID in context of education, freedom, and health. So I think you've elaborated specifically on education and health. Would you like to comment on freedom and how that might be affected because of
Again,
this?
I'll come back to the point I've made, right? Was there freedom before COVID? Are we living in that world where we're saying there was freedom before it? If there was any semblance of freedom before, it's going to go down further, right? Why? Because choice is also increasingly a byproduct of how aspirational your family is, or how how much thriving position they are in. If they're in survival mode, their choices in itself, their freedom in itself is under question, right? So the downstream effect on children is even worse, right? I would say it will, the freedom index for girls, if there was anything like that, would indicate to you that child marriages will be rampant, right? Child trafficking will be rampant, and government is thinking on it. It's not that the government is not thinking on it. Government is very cognizant, and is already putting plans in place to ensure that that doesn't happen. But I think acceleration of child marriage, child trafficking, child labor, and getting access to stuff like mobile, internet, etc., will obviously not be there now. So if they were in a position to get some sort of a freedom, safety and security will be an issue, right? Because large unemployment, crime rate would increase, right? So safety and security will be a challenge, right? Provisioning of basic infrastructure will no longer be a priority, because that money will be put to other use. So our roads will not be safer, our water sources will probably be farther off, right? So that sort of pushes the freedom index. If these are all the broad contours of what constitutes the freedom for a girl, these all will be sort of regressed, and that's the unfortunate
Right.
reality.
Right. Um, we also have more questions. Tanmay, so what uh, could be the measures to stop child labor at the household level? You've addressed how child labor has become more rampant, etc. Any experience or any evidence where we are seeing, for example, the community members, stepping in, and any innovation at the community level where there's kind of trying to address these issues which are being faced by girls, especially during the COVID?
I think community, if sensitized to these issues, and especially if their outcomes are linked, for example, ration delivery, vaccine delivery, or anything is linked to the fate of the girl child in that village, I think things could work. So disruption could be link all the subsidy, all the grants, everything to girls' education and the girls' freedom and the girls' health, right? And the focus. Without incentive, I don't think societies will give priority, because patriarchy is so rampant in these villages that they just a blanket of ignorance, or a veil of ignorance, which is worn by the community. So unless we link it to the survival and the thrival of the community, it won't unfortunately happen.
Right. So that's I think a very important point which you're making is to incentivize and incentivize the household, the community, to ensuring that the best outcomes are achieved for the girls in the family as well as the community. And in terms of, if we talk about, there are schemes which, for example, talk about girl child completing 18 years of education. At the time they reach 18, that's when a scholarship amount or a financial transaction is made in the account of the girl. Right. So these are certain long-term policies as well. So in the short term, you mentioned, for example, Russian could be linked to that, to the child, right? So I think this is one very interesting policy where, and all the different stakeholders who are also listening to us, we are working with many of the government stakeholders as well that are in our network of Global Dream as well. So this is definitely something which can be done as well. Um, what do you feel is the role of, I mean, of course, you are leading policy at the government level. What do you think is the role of other peer stakeholders, be it NGOs, civil society organizations, corporates and CSRs? They are also taking lead in a lot of aid and support at this point of time. If we really need to get out of this situation, what would you say to all these other peer stakeholders?
I would say that whatever money has been committed, aid, let's come through on our commitments, right? Let's not leave the non-profits hanging in the middle, right? I know it's very easy that we've diverted all our funds to XYZ, But if you committed, if there are any funders listening, I would really because there are non-profits which are addressing last mile delivery failures, and if you're not able to fund them at this crucial juncture, the eventual beneficiary will not even remain to get education, to get anything else which you are funding, probably skilling and stuff, right? So I would say this is the time for survival, not time to sort of look at innovative grants or grants where we don't know where the funding is going. This is the time to honor our commitments to ensure last mile delivery of ration, of vaccines, of healthcare facilities, in terms of your what you say, the kit, the health kit, right? And also ensuring clean water, clean menstrual hygiene products, which we've entirely forgotten menstrual hygiene as part of our larger lockdown mechanism, to think that, okay, how's that being tackled, right? So if the focus could be on basic survival and honoring our commitments to ensuring that non-profits are able to continuously reach out to its own people and ensure that we don't leave our communities in the need of the hour, right? So my only humble submission to everyone who's sort of supporting non-profits is that this is the time to give, this is the time to support, not to sort of wait and pull back on the funding. And even some due diligence mechanisms could be, a regulatory framework, even the FCRA, etc. Everybody needs to take a humanistic view, the government, the other stakeholders, to ensure that we are not stuck in the red tapeism and bureaucracy of due diligence, to ensure that money doesn't reach the ground, right? So our aim should be, how quickly can we reach out to our communities and ensure that they feel supported at this point, right? Building narratives around girls in community is very difficult, right? It's a tough task to convince a community to send the girl to school, right? And if you're not seen helping the community at this point, you will never be able to make that trust, right? Help the community right now to unlock gains in the future, right? To unlock that sustainable trust which has been built over years, to give you results on other things such as health, education, inoculation, menstrual hygiene, etc., right? So my only humble submission is, ensure that every family gets to eat at least 2 square meals a day, if not 3, right? 3 is the ideal situation, but and if we can sort of look at mechanisms of self-help groups starting off again, right? Self-help groups funding has been totally gone, because whatever funding the self-help group had has been deployed to saving lives of the community people within those self-help groups. So give funding, micro lending institutions should come and give funding again to build these self-help groups, and this has been a phenomenal rise of self-help groups across various states. So give them capital again to reestablish their sort of self-help group, and sort of see the sort of demand grow. And it helps economy as well, in a sense, because if the rural economy starts, then only you will see the GDP coming back to where it was.
Absolutely. So on that note, Prateek ji, we would like to conclude the discussion as well, and what I think some very very important remarks have been made by Prateek ji here, which is essentially talking about how foundational literacy and numeracy is very much poised, and it is very much connected with a lot of other sustainable development goals. It has to be health, it has to be nutrition, and all these important factors are crucial for enhancing the foundational literacy and numeracy. Prateek ji, would you like to, in conclusion, share any any final comments in terms of what should be the call to action now, in the short term, and in the long term, once we are, once COVID eventually, hopefully, when it have completely gets over, what should be the top 3 priorities and calls to action for everyone in this sector?
I think figuring out vaccination for children, right, so that the next wave doesn't hit them really badly. Because we've been hearing a lot about potential impact of COVID going forward on children, right? I don't know. I don't have empirical evidence to prove otherwise. But if there is a threat, let's understand that threat, address that threat, prepare for the world over trials have started on children under the age of 12, 0 to 12 and 12 to 18. So let's do those trials, ensure that rural population is vaccinated, their parents are vaccinated, school teachers are vaccinated, and we start the health and the nutrition aspect of it again, right? Both in terms of inoculation. A lot of children 0 to 4 have missed their inoculations because door-to-door polio drive, etc., had been stopped, right? I know some of the states have started them again. The Anganwadi system needs to be strengthened more, because that might be the first, the ASHA worker and the Anganwadi workers will be the first port of call when it comes to health and nutrition of 0 to 4 population. So I think my overall call to action would be strengthen the Anganwadi system, strengthen the ASHA workers, and strengthen the sort of the health and the nutritional aspect of it, right? Ensure that our schools are geared up and vaccinated. The teachers, the system is vaccinated for an early opening, because we've had 2 years almost by the time we open up of school education being missed, right? And we need to have a way in which we cover up for this, right? Whether we have digital learning initiatives, some states have started all India radio broadcasting, TV broadcasting, bite-sized information on WhatsApp being available for people who have phones, right? So we need to try to ensure, how do you bridge that 2-year gap? As it is, there was a gap in education, as per the ESSER survey, but that gap, if you look at that, will be widened. Also do a data analysis of understand the baseline of where we are after the pandemic, right? So that at least we know where to go. Without data, we will not even know what to attack first, right? So collect data, right? And sort of be empirical in your approach towards addressing these concerns.
Absolutely. So on that note, we conclude today's session. Prateek ji, thank you so much for your very valuable insights. And like you mentioned, that it's very important that we are already preparing for what lies in ahead of us. Of course, right now it's survival for a majority population of our country. So it's very difficult for everyone to plan ahead. But for those of us fortunate who are able to have foresight and are able to see beyond our survival in the future, we need to start preparing. And this is what the message that we would like to share with all our stakeholders as well, who will be seeing this video as well. So thank you, Prateek ji, once again. And towards the end, I would like to again mention about Global Dream as well. So as all of you are aware, that Global Dream is looking to scale up literacy and education, and we are always looking for partners who want to scale up literacy, and be it from governments, be it from the civil society organizations, and if any one of you who's watching is interested to learn more about our 30-hour literacy methodology, you can reach out to us. You can visit globaldream.guru website. You can email us at scaleup@globaldream.guru, or WhatsApp or call us at 740-840-6000. So this is something which we will continue our conversation on. Tomorrow we'll also have Mr. Nixon Joseph, who is the former CEO of SBI Foundation, and who has had a lot of insights on education and literacy projects as well, who will talk about what the role of CSR should be in dealing with this crisis. So with that, thank you everyone once again for joining us and who will be watching this video. Thank you, Prateek ji, again for your very valuable time and very valuable insights. Thank you.
It's a pleasure. Thank you for inviting me, Masud.